I'm pharmacist Kevin Hope, and welcome to 5 Minutes with a Pharmacist. Today, I'm joined by Dr. Ronnie Moore in New York City. And New York obviously was one of the cities that was very hard hit by the COVID-19 virus very early on. And Dr. Moore, you're doing some pretty interesting work in your community there. Now, fortunately, we have vaccines on the table, and you've been very, very involved in that effort. And things are starting to look a lot different in New York than they were when we were first faced this pandemic back in March of 2019. So tell us a little bit about what you're doing there in your community.
Sure. Thank you, Kevin, and good morning, and thanks for having me. As you said, we're here in New York, and we're actually in the borough of the Bronx, which was one of the hardest hit boroughs during the pandemic. Still has one of the highest rates of infection rate for COVID. And what we've been doing, and from the team from top down, is getting out and doing community vaccinations. We've been doing them for individuals that live in conjugate settings, from those with mental disability to those in the vast shelter systems of New York City, from family shelters to post-incarceration shelters to post-substance abuse shelters. It has been a challenge, with at least to say, making sure that we were able to coordinate first dose as well as second dose for these folks. And also working with their administration and caseworkers to understand that it's important for this vulnerable population that's normally not connected to healthcare, that there is options and there's access for them. So we've been able to not only vaccinate, but also educate this population on ways of staying healthy, ways of practicing good social distancing. We've been able to also provide them with PPE, which has really helped the rate of infection in these close living conjugate settings where there were outbreaks, and it's been pretty hard for these type of individuals to separate. In New York, they sometimes use hotels to separate these individuals, and because of our efforts, we've been seeing a definite turnaround. We're working directly with the Department of Health, and this has been an effort not only from the pharmacists that work here at Allure Pharmacy, but from our technicians, who every morning we have our morning meeting on where pharmacists will be going out to vaccinate. The technicians have been preparing our travel vaccination packaging, as well as keeping a spreadsheet for documentation on who needs to be vaccinated, who we need to follow up with, and keeping a calendar and keeping us in check. So they've been kind of our home base.
Right. Absolutely. So wonderful, wonderful work that you're doing there, especially with this patient population that, as you said, normally not connected to those normal outlets for patient care. And so fantastic efforts there on the COVID-19 front. So let's take a step back from COVID-19 and tell us a little bit about what your operation normally looks like. Before all of this pandemic, kind of what were you doing on a day-to-day basis?
Sure. So pre-pandemic, Allure Pharmacy is actually what I call a three-component pharmacy. We have a retail setting that's comparable to any of the major big boxes that folks can come in and get their chronic medications. We also have a long-term care component, which we do service a lot of folks in conjugate settings. So it was very easy for us to transition to that vaccine setting for them as well. And then the third is we have a counseling and MTM center where we work with insurance companies on some of their high-risk patients that they actually send emails to our center for us to follow up with and counsel patients on either getting a 90-day supply of medications or work with their providers to make sure the proper medication regimens are there for the different disease states that these patients have. Sorry, I'm getting paged at the same time, so it never stops. Yeah, the three components really are how we work here, and we have technicians that are actually certified nationally, but also have their own specialties. So we have what we call our retail technicians, our clinical technicians, and they work in the different areas of the pharmacy. And the same thing with the pharmacists that work here.
Thank you so much, Dr. Moore, for taking some time out of your day today to share with us a little bit about some of the wonderful things that you're doing there in New York. So, and thank you all for joining in for 5 Minutes with a Pharmacist.